What does the color of your period blood mean? According to gynecologists, the color of blood you experience during your menstrual cycle is closely related to your internal health. Your period can come in a wide range of colors, ranging from classic crimson, red to brown, black, or pink. It can be super scary and confusing when you see a color you're not used to seeing during your cycle, but fear not, because in this video, we're going to explain what it means when your period is brown, black, or even blue. As you are probably aware, period blood is different from the blood that you would get from a skinned knee or a superficial cut. Because it's combined with your uterine lining, the color isn't nearly as bright as the other blood you might have seen from your body. Period blood ends up more of a deep cranberry shade. Whenever your period blood is this color, it indicates this is new and your uterus is shedding as it is supposed to during your menstrual cycle. You will typically have bright red blood during the middle of your menstrual cycle. If you experience this when you're not supposed to be on your period, you may be experiencing spotting, which is completely normal. However, if it's accompanied by cramping or pain, it could be an indicator of an underlying illness, such as a cyst. Black blood flow is a symptom of three things. One, it can be old blood that sat in your uterus for too long, which sometimes happens and is nothing to worry about. It's completely normal. Secondly, black blood could indicate that you have an infection in your uterus. Last but certainly not least, black blood flow can be an early sign of a miscarriage. If you are experiencing black blood flow throughout the entirety of your period, contact your doctor as soon as possible. If you're seeing dark blue or purple bleeding, it suggests you have excessive estrogen in your system. But don't be alarmed. This isn't a big deal. It simply implies that you need to incorporate more fiber into your daily diet. You'll also have blue or purple color when you are having blood clots. During your monthly cycle, clots and clunts are to be expected and are nothing for you to worry about. Blood that is light red or pink colored occurs when your period is lighter than average or when you're spotting. It's natural to have a light period flow on occasionally, particularly if you're feeling stressed, are extremely athletic, or have undergone a drastic change in your weight. If your period is light consistently, it could be an indication of a vitamin or nutrient deficiency, which may place your bones and heart at risk. Now is a good time to examine your diet and make sure to eat enough protein-rich foods. If your period blood is orange or has an orangish tint to it, but the consistency and smell don't appear any different compared to your regular menstrual blood, it's probably not something to be concerned about. Conversely, if the texture or smell doesn't seem right, this may be a sign of a sexually transmitted disease or infection. Should this be the case, make a doctor's appointment immediately to get yourself examined. Often, women notice brown or dark brown period blood near the beginning or end of their periods. Others notice brown-tinged spotting mid-cycle. Generally, this is considered normal and is nothing to be concerned about. But if you are having brown blood or brown discharge after your period has ended, this may indicate an underlying health condition. Especially if you experience brown blood along with cramping, it may be an indication of pelvic inflammatory disease, also known as PID, which is an infection of reproductive organs. It usually occurs when sexually transmitted bacteria spread from the vagina to the uterus, fallopian tubes, or ovaries. PID is very common. More than 200,000 cases occur in the U.S. every year. Brown bleeding after your period could also be an indication of endometriosis, which is a disorder in which tissue that normally lines the uterus grows outside the uterus. With endometriosis, the tissue can be found on the ovaries, fallopian tubes, or the intestines. The most common symptoms are pain and menstrual irregularities. Effective treatments, such as hormones and excision surgery, are available. Cervicitis is also something you could have if you're having brown blood. Cervicitis is an inflammation or infection of the cervix. A multitude of different organisms can lead to it. Cervicitis can be either acute, meaning symptoms develop rapidly and are severe, or chronic, lasting for months or even years. Cervicitis can be transmitted by any of a variety of sexually transmitted diseases, including chlamydia, gonorrhea, herpes, and trichomoniasis. It is often misdiagnosed with vaginitis. Symptoms of cervicitis are purulent discharge containing pus, pelvic pain, bleeding between periods or after intercourse, or urinary problems. Sadly, brown blood could also be a sign of a pregnancy, which is a pregnancy in which the fertilized egg implants outside the uterus. An ectopic pregnancy most often occurs in a fallopian tube, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes an ectopic pregnancy occurs in other areas of the body, such as the ovary, abdominal cavity, or the lower part of the uterus, cervix, which connects to the vagina. Early warning of ectopic pregnancy is light vaginal bleeding and pelvic pain. If blood seeps from the fallopian tube, you may feel shoulder pain or an urge to have a bowel movement. Your specific symptoms depend on where the blood collects and which nerves are affected. If the fertilized egg is allowed to grow in the fallopian tube, it can lead to the tube rupturing. Heavy bleeding inside the abdomen is possible. Symptoms of this life-threatening event include extreme lightheadedness, fainting, and shock. Brown blood can also be a sign of uterine fibroids. Fibroids are non-cancerous growths of the uterus that often appear during childbearing years. Uterine fibroids have not been linked with an increased risk of uterine cancer and almost never develop into cancer. Uterine fibroids vary in diameter from tiny seeds that are undetectable by the naked eye to massive masses that can deform and enlarge the uterus. You can have one fibroid or a number of fibroids. In extreme cases, multiple fibroids can expand the uterus so much that it reaches the rib cage and increases your weight. The majority of women have uterine fibroids throughout their lives. But you've probably never realized you have uterine fibroids because they don't usually have any symptoms. Your doctor may detect fibroids accidentally during a pelvic exam or prenatal ultrasound. Most women who have fibroids don't have any symptoms. In those that do, symptoms can be influenced by the location, size, and the number of fibroids. The most common signs and symptoms of uterine fibroids are brown blood in between periods, heavy menstrual bleeding, menstrual periods lasting more than a week, pelvic pressure or pain, frequent urination, difficulty emptying your bladder, bowel constipation, backache, or leg pains. If you have uterine fibroids, you may experience as little as one of these symptoms or all of these symptoms. Uterine fibroids can be diagnosed by your gynecologist or primary care doctor during a pelvic exam. During the pelvic exam, your doctor will evaluate the size, shape, and overall health of your uterus. If you think you have fibroids, please contact your doctor immediately to schedule an appointment. Like, comment, subscribe. See you next time.
We release new videos every Thursday, Friday, Saturday, and Sunday. Subscribe now so you never miss a video. Thank you for watching and see you next time.